Dr. Jen back again with an important health and wellness question that one of you, our viewers, are asking. Here it is. I've heard about PRP for hair loss. What is it, and how do I know if I'm a good candidate?
All right. Actually, this topic is in my new magazine, Better. So platelet-rich plasma, PRP. It's been around for a while. It's used a lot in orthopedic surgery for certain things. It's been being used for hair loss or thinning hair in the world of dermatology for almost 10 years now, largely off-label, initially experimental. Now there's really, really good clinical data about its pros and cons. Basically, it involves extracting a vial or two of your own blood. It's spun down in a centrifuge with some growth factors in a tube and then re-injected into your scalp.
Yeah.
Exactly. I've actually tried this years ago. I had a particularly good result with it, but it's not for everyone. Pros and cons, you know, who is it for? Male pattern and female pattern hair loss, some types of scarring and non-scarring alopecia, but it was being tested for COVID hair loss. It was being tested for chemotherapy-related hair loss. The results and for those indications are a little more erratic, if you will. It's incredibly expensive. That's probably the number one downside, if you will. And it's important to understand that if you're going to try this, to go to a dermatologist who really does a lot of this. Otherwise, your chances of not getting the proper technique or getting ripped off go up. Typically, you need a couple of treatments, you know, one a month for, let's say, 4 months. And again, it works from an anti-inflammatory standpoint and a regenerative medicine kind of standpoint.
But is it painful?
I think it is painful because it's your scalp, and you do need a lot of, you know, punctures or injections. But I'm also incredibly wimpy, so you might not find it uncomfortable.
We're twins on that one.
Yeah, but again, when you talk about something that's in its earlier stages, understand that it's not for everyone. It is expensive, and you might not get the result that you're looking for. But for a lot of people, it's been promising.
I hear PRP and I think of those vampire facials.
There you go.
And keep those questions coming. You can send them to Dr. Jan at ABCGMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.